Alright guys, back for kind of part 2 of this patella tendon, kind of tendinopathy kind of stuff. Just kind of want to go over some basics of the patella. Okay, so first here at the patella, so my foot's down there, so it's kind of backwards for you guys to kind of look at. So you got the inferior pole, okay, superior pole, medial, lateral. Okay, then under it you have like the odd facet and all this kind of stuff on the underside. And so those facets under it, they kind of have grooves to accommodate to the tibia and the femur. So when you're going into knee flexion, they can slide and get placed properly. So if there's some type of genetic issue going on where your facets of the patella are kind of off, that can lead to deterioration, degeneration, all sorts of kind of issues. So first thing I kind of want to just go over is why the patella is kind of like a big issue in sports now. So you have the part of the tendon of the patella that attaches to the tibia, and another part that attaches to these quads, 4 quads. Alright? So basically the patella, when you are doing different movements, the patella goes under different loads. So, for example, when your knee like this is completely relaxed, basically 0 degrees of knee flexion, the patella actually rests above the kind of the groove that it actually sits in. So right now it's not even really in that groove. So that's why it feels nice and good, nice and relaxed, no pain here because there's nothing being placed on it. But as you go through ranges of motion, let's say squats, that patella gets put in that groove. So if you can kind of follow along, as my knee gets more flexed, this patella moves down, down, down. And if you're in a super deep squat, like ass to the floor, doggy, that patella actually, Dora, get over here, come on. That patella actually isn't even in the groove anymore. Well, it is, but it's barely in the groove. And studies have shown, especially in the kinesiology book that I read, that those shearing forces are at its greatest at the bottom of a squat. Now, I'm not talking about like a 90-degree squat. I'm talking about like a extremely deep squat, like your butt's almost to the floor. You know, that's kind of the stuff they like to do in CrossFit, etc. So studies show that actually has the most shearing force on those patella grooves and facets on the underside. But yet people still tend to do that with their squats. Actually, where the patella has the most contact is about a 90-degree squat. Okay, that's actually where you get the most leverage too, most power out of a squat. So it's kind of interesting that you know, the power generated from a squat is actually somewhat dictated by where the positioning of the patella is. So that's why I kind of recommend when I'm teaching people squats and stuff that you do not go extremely deep, and that usually going just 90 degrees is great. And you can kind of load more weight up because you don't have to worry about going too deep, and if you're in trouble, how much weight you have. So next thing I kind of want to show you guys. Okay, Thor, you gotta get over here. Doggy. Okay, so you see the patella. So like I said, when it's in 0 degrees of knee flexion, your patella is basically out of that groove. So what we can kind of do here is do a little mobilization. Okay, now this is nothing like, you know, extremely dangerous, or you know, you need to be like a professional to do this. However, I would recommend doing that, having a PT do this, but you can kind of do this on your own because you can gauge it. So basically, what you can do is take the patella, and since it's out on a groove, you can actually just move it around. And so in a sense, this is kind of a mobilization because we are just moving that thing around. And this actually gives a lot of pain relief to people with patella tendon issues. I like to kind of think of it as like waking up the patella, even though there's no muscular properties of the patella. It's not like actually getting innervated and like, it works better. I like to just think of it as like you're kind of putting it in a good position. So you do some medial distraction, lateral distraction, superior, anterior, inferior. And so it just kind of relaxes it. It puts it, in a sense, kind of realigns it. Especially after you did stuff like this, it actually gives slack to this tissue. So it's just good to kind of move it around. Make sure, in a sense, it's like putting it back in a correct position. It actually just gives great pain relief. People with this problem, just to move it around feels pretty good, honestly. And this always feels good. You just take up all the skin here. You kind of grab some of this fascia and just do that while moving it. And so this actually has some really good stuff. And you kind of do this on your own. I wouldn't really recommend doing this before you play or something. After you do a stretching session or something. All that stuff. So you just want to mobilize it. And so, yeah, just going back, you want to take care of this stuff up here. Once this is taken care of, we can kind of figure out what's going on here. But like I said, the patella and this quadricep area is a direct impact from the foot and the hip. Okay, so the knee and the patella is just the intermediate between those two. So we need to fix problems down there and at the hip, mainly the hip. Studies show that about 80% of movement is dictated from the hip and only 20% from the foot. So if you have to choose, really focus on the hip. Glute med stuff, flexibility, etc. But we need to attack these tissues as well. So there you go, guys.